art of healing really is listening. And trauma is not what happened to you. It is what happened inside of you, and how that effect or has on your body manifests in itself very uniquely. So once we can uncover sometimes that root, we can really bring up and have that access to your true self.
Hi, I'm Dr. Monica Jauregui, and welcome to Truly Healthy MD. I have one question for you. What's really behind the way you feel? As a functional medicine doctor, I'm passionate about helping you uncover the hidden causes of your health concerns and finally connecting the dots. From balancing hormones to overcoming Lyme disease, boosting brain health, or just finding new ways to feel your best every day. This podcast is packed with insights and strategies to help you take control of your health and live fully. Ready to explore what's possible and be truly healthy?
Welcome back to the Truly Healthy MD podcast. Today, I have the honor of having Dr. Alya Ahmad. She is the director and co-founder of Shaw Minds Healing Center. This is in Sacramento, California. She integrates narrative medicine, complex care, ketamine-assisted psychotherapy, and integrative medicine to provide holistic care for adults and adolescents. She is a former associate of pediatrics at UCSF. She taught narrative medicine methodologies and continues to conduct workshops for patients, for healers, and for educators. Thank you so much for being here. What an honor and a pleasure. And today we're going to talk about ketamine as an integrative tool to root cause treatment of mental and functional conditions. A big welcome. Thank you for being here.
Wow. That must have been a mouthful, but thank you for coalescing.
Yeah, it's always
experience of life in that, after that. And I appreciate it.
It's I love meeting so many people through my podcast, and it's a pleasure. And I'm so thrilled to have you here today. As our listeners probably know, psychiatry is such a difficult thing to treat because we, as a conventional medical community, sometimes we don't have real tools for healing. Sometimes we only have tools for making people feel less symptomatic. And so I love speaking to every single integrative psychiatrist that I've ever met, especially those with expertise in nutritional psychiatry. And what we're going to talk about today is about ketamine, which is something that is up and coming, and it's amazing the healing that people can achieve from this. So before we get into ketamine, tell us more about you as a person. I always read all these things that tell us how much training people have, but tell our listeners who you are as a person. Tell us a little bit more about you.
Okay. Well, I guess I'm a physician, of course, as you know. And before that, I am a mother, a wife of married 9 years now, and have traveled the world, really. I feel even early in life, crossed over many different continents. These 4 before coming to the United States. I came as an immigrant to Texas, grew up, and then went back and worked overseas as well. Because once you have the flavor of working or being overseas, I wanted my kids to have that experience of living overseas and kind of seeing the world. And so I've seen a lot in my life, had my own traumas and my own experience, of course, as an immigrant, and, being an imposter, really feeling like, I never really belonged in any one country. Traveled from United States. Before that was born in Africa, then had to leave Africa, then go to England. So lived in Europe, and then we moved to Asia, and where I was in Pakistan, and kind of had a unique childhood, I would say. Parents were quite my father really stressed a lot on education, and opportunity was in the United States. And so we moved to the United States really to have a better opportunity. And through those experiences of travel, of seeing and witnessing different cultures and languages and ways of living, I feel like I have a rich understanding of not just my own experiences, but kind of in that unique lens of seeing things from different angles as well. And then, of course, when you speak different languages, that also really brings in the flavor of kind of the understanding of different facets of people's lives. Language is an important component to how people communicate, of course. And so I feel very privileged and honored that I've had that experience of learning a different language, learning even English in different ways, right? British English and American English,
Absolutely.
and even in Asia, the way we speak English is different. So even versions of English and then versions of different languages and dialects. My mother is probably the most resilient person I know, and now as a physician and as a daughter, my father passed away kind of early in his life, at least, and that was a very traumatic time for me and our family. But now I see my mother, a very resilient, very, very capable woman of her time, and how she's aging and how her life effects are coming through and showing up in her mental health. So, and of course, when you travel different countries, you can see the culture and the way mental health is seen or treated. There's quite a different variety types of approaches. I've also had the experience of seeing and witnessing different types of holistic practices, both in Eastern and Western, and even in my own academic training, and even as a professor, really bringing in that element, even with narrative medicine, right? Using the creative arts of healing, using creative modalities to really understand conditions in a very unique way, so that I think as providers, we often miss that element of how do we recognize what pain feels like. Pain is not just a number. It's actually, it has a context, and it has a context in how people live with that pain, but how well they communicate that, and how is that seen and understood. And so I find that I've been able to use all my skills through my life, and now at this point in my life, kind of coalescing all of those experiences into a place of healing, which is where integrative medicine comes in and where narrative medicine comes in. And of course, with ketamine as a newer kind of modality or alternative modality to healing conditions that are treatment resistant.
If you like this discussion, please hit the subscribe button and consider leaving us a review. It really helps people find us, and we truly appreciate your support.
Amazing, amazing. I love all how you are able to bring all your life experiences to help people. I know that diversity right now is something that's a hot topic in the news, and I strongly believe that diversity is the best thing for humans. And the fact that you have such a rich upbringing, I'm sure, helps you reach people at a deeper level than if you did not have that rich upbringing. So that's amazing. Thank you for sharing that background. It always helps people understand us better when they know us as a person too, right? Not just as a physician. So thank you for telling us that. That's pretty amazing. So to the subject at hand. So you're in Sacramento. You have your own clinic where you practice root cause medicine, and one of the things that you use is ketamine. I think a lot of people I want you to help our listeners understand more about ketamine. I think a lot of people have this misconception that it's just for treatment of maybe depression. It doesn't really get to root causes. But how can you explain whether ketamine does or doesn't help people heal from a root cause approach?
Okay. Well, ketamine is I call it a legal psychedelic. And I say that word, it is a nuanced word, because psychedelic to some people means, oh my God, is it a medicine that causes psychosis? Or is it a medicine that will change the way my brain works? Because we often associate psychedelics to different substances. But as a psychedelic and as a medicine that works on the nervous system, as an anesthetic medicine as well, in the sub-anesthetic dosing, it really allows for that body to enter into a deep kind of meditative state. And in that meditative state, one is able to help, you use it as a tool to help process sometimes those feelings of anxiety, sometimes being those symptoms being lifted during that state, and where patients can really access sometimes memories or have insights or even have relax where thoughts are, the default mode system of the brain is really turned down, and one is able to access more of the sensory somatic cortical centers of the brain, just like we do when we dream. So as we dream, that is a restorative state. And in that restorative state, there is an opportunity to really help process sometimes, as one has when one dreams about certain things that they recall, or but without the emotional reactivity or without that response that the body has for that memory. So it's a way of observing one's experience without feeling activated or triggered. And with that, there is an opportunity to really look and observe and separate the effect of that trauma that has on the body for that period of time. Now, it is a medicine, and this is the kind of there are many types of experiences or effects that medicine has on an individual, and each time it's a unique effect. So it's really hard to predict what kind of effect patients would have, but it does, as a medicine, it is an antidepressant. It is help reduce anxiety, and it is help reduce inflammation in the body. And so it works at that level as well. And it works as a GABA, and works on the whole different receptor system in the brain. Most of conventional medicines are either SSRIs or SNRIs, or medications that we use for seizures, right? That reduce, again, the activation of dysregulation activity in the brain, which causes symptoms like depression or anxiety or pain and even ruminating thoughts. So ketamine works on a whole different operating system, on the GABAergic system, increasing glutamate, and again, tuning down areas of the brain that are where we have a lot of fixed, mechanisms that create that ruminating, negative self-talk. And so kind of disconnecting that during your session can help kind of lift that patient away from that fixed ways of thinking.
Right. Great. Okay. So our listeners are people of all walks of life, and I think there's a lot of people out there who could potentially benefit from ketamine therapy, but just haven't heard enough about it to understand if they could possibly benefit. So what type of patients do you see in your practice that you treat? What kind of conditions do these patients have, those patients that you help with ketamine? And for our listeners out there, who might be a good candidate to seek out this therapy?
Yeah. Well, when we first opened and our website went up, and within the few days, we started getting phone calls really for patients who were just Googling and were looking for alternative treatments that were to help their depression, or they were really struggling. They had already tried many other things, other medications, and it was really in the middle of the night, that they were Googling, and then we would get these phone calls. We got, a lot of messages on our phone system, and it was unexpected because as a physician, I was thinking patients would come through the referrals, through other doctors or therapists, but really most of our patients that come to us are really patients who have tried everything else and nothing else has worked, or they have a lot of complex trauma and haven't had a place or nothing in terms of therapy. They've come to a place where they cannot even do therapy, or they are struggling with what's happening in their life because of their chronic condition. And so they've been through the system. They have seen many, many providers. They have been on a slew of medications. And so that's really our typical patient, very complex, and who have struggled for a long time and have really, the system has failed them, And now that we know some of the data on treatment-resistant conditions, we can say, yes, by the time a patient is on the third or fourth line of treatment for the depression, the efficacy continues to drop with each change of their medication. So by the time that they're on the fourth trial of medication, their efficacy is only going to be about 4 to 7%. So that means 93 to 96% of patients are not responding, and that's based on the STAR-D trial and a lot of the studies that are now coming to light. So those are the type of patients that we see. We also take care of patients from veteran patients as well at our center, and we're a referral center for the veteran organization. And as you can understand, there's been a lot of trauma in military, and there's a lot of moral injury. And so those are also the type of patients that we take care of and support. So, and of course now, as a former, as a pediatrician, pediatric hospitalist, some of the things of my own experiences in the emergency rooms was treating and finding a place for patients who were acutely suicidal and had no place to go and were waiting for beds and had to be transferred and often being boarded in the emergency room, which is very, very traumatic in its own right.
Absolutely. Yeah.
So the type of patients that we're seeing are patients who are acutely, having suicidal thoughts. And so ketamine really is a medication that when it works, it has a very fast, robust response and really can be quite much more effective at treating suicidal ideation very quickly. As you know, probably conventional treatments with SSRIs, it takes 4 to 6 weeks sometimes to clear those type of suicidal ideating thoughts. And sometimes the risk is even higher when you start medication with conventional treatment. So there's always that risk factor associated with that. Our adolescents, the increase in mental health condition has, since coming back to the United States after working overseas, I was profoundly shocked by the rise in mental health conditions over the last few years, which is only getting worse. So the other cohort of patients that we are seeing are, the adolescents and young adults. COVID really, as you probably know, really brought to light mental health to a new level as well. And so that effect during COVID, we actually did open during COVID in 2021. And so it was pretty apparent that, again, access to care and patients who did not have a place to seek help or seeking help outside of the care because of COVID and because access became even more challenging.
Fatigue, brain fog, mood swings, weight gain. If you're a woman in your 40s to 70s, you've probably been told that it's just aging. But what if it's not? At trulyhealthymd.com, we look deeper. Hormones, nervous system health, hidden toxicities. You're not broken. You just need a doctor who really listens. Visit trulyhealthymd.com and book a consultation today. It's time to feel like your real self again. And so really helping a lot of people who, maybe are not getting what they need from a conventional system and going above and beyond for those people. So I'm so glad that you're able to offer this. If somebody is thinking of going to a ketamine clinic, what can they expect? Do they need to have a consultation with a physician first? Do they just go in and get a ketamine? Is it just one session? Is it multiple sessions? What can they expect before they make that first phone call to try to get in?
Yeah, well, there are a variety of clinics and types of ketamine treatment centers, ranging from even in the hospitals. I mean, when I was first using ketamine as a hospitalist, we were using it for treating chronic regional pain syndrome. We had patients often come in overnight and stay for a course of, time for IV ketamine infusions. Little did I know at that time that, those patients were improving, their mental health was improving as well. And you'd often see that, when they would come in, they would want to do their treatments and they really looked different after their treatments. So what would somebody expect? Our approach in our center really is around the whole person and really addressing not just the mental health condition, but who they are and what is their body's response to their condition as it is now. So we really look at the whole person. We look at their functional health. We look at their nutrition health, sleep health, their hormonal health sometimes, and other comorbidities, other factors that may be affecting or worsening their effect on the mental health, such as, IBS or pain or immune conditions that may be a trigger or worsening because all of it's connected, the brain and the gut is connected. The sleep affects mental health, stress, of course, and how they're living, where they're living, what they're exposed to, their environmental health. So we do try to take a very comprehensive look and of their care. So first thing is we would do a full kind of integrative appointment with them, and then think about, well, what is their condition, and would this be a good option for patients? Now, therapy is a very strong component to that, and that assessment of therapy, whether they're at a place to do the therapy, have they've had therapy before, what type of therapy they've had, and what is their belief and understanding of treatment, and their willingness and their knowing that this is an intensive process, and recognizing that they have to be emotionally prepared to do sometimes this deep work. So that's kind of our approach in our assessment and in our onboarding. Thereafter, we take on, that approach and tailor it to what would be most beneficial. Meaning, if we need to prepare for treatment, if they have IBS or if they have other conditions, we would consider, well, let's look at the nutritional component and really build that, as you would when you would prepare for a big journey. If you had to hike up into Mount Everest, you wouldn't go, without a plan, without preparation. So really do stress that in our practice. And then we start treatments, and those are usually IV, intravenous or intramuscular treatments of ketamine. And then we provide the therapy before and after their treatment, so that they have the whole, their treatment is encased by support and facilitation. And then there's a series of 6 sessions. We make assessments on how their response is, both clinically, objectively, and subjectively, and then follow the patients as they go through that. And often maintenance is required thereafter based on their response. That's our approach. There are many centers out there that just do IV ketamine infusions and do therapy, or may not do therapy, or may not stress that. In our view, and I think in a lot of the healing centers that stress kind of this approach, there's a lot of talk about, taking this treatment differently than one would just writing a prescription. This is not a medicine that should be administered without, in our view, and in a lot of people's view, without that sort of consideration of, is this the right choice? And there's an ethical component to that too, because sometimes that readiness is not there, and sometimes you may worsen an effect if somebody's not prepared to what comes up in their experience.
Absolutely. So it sounds to me like there are some places where people can get ketamine and it's just straightforward. You show up, you get the ketamine, and you leave. But people who work with you need to be ready to do more work. They need to be ready to do the hard work, right? The hard work that might be more time consuming, more just an investment of their time and maybe their finances, because they're spending more time with you. Do you see a difference in the long-term results with people who just go to ketamine clinic without doing that hard work, and the results that you get patients?
I would have to really look at that. I mean, our data, and we've tracked our data and looked at our response, and we actually have really good outcome. Most of our patients, 80-90% of them, our patients usually have a very positive, strong response. I would say about 50 to 60% of our patients go into remission and stay in remission for a longer period of time than in comparative studies. If we look at, broader outcomes across the board, I would say getting to remission, in most places about 40-50%. And remission means, greater than 50% improvement in treatment symptoms and condition from beginning. You can imagine, when I was treating patients just conventionally, just even having any reduction in symptom took a long time. And if there was even a significant reduction, that was much more limited. And so in comparison, when we see treatment response, we see, are you okay? Yeah, it's a cough.
I muted myself, but I coughed.
That's okay.
You saw me coughing, but I don't think our listeners saw me coughing because the camera was just on you.
Yeah, so we see that benefit quite dramatically. Sometimes within a few sessions, patients look different. They suddenly the depression is just lifted, and that's pretty remarkable effect compared to any of the conventional treatments. And doing this for a long period of time, you even see patients feeling more physically active, they suddenly become more aware of, well, now I feel like I can take care of my health. I can actually now think about eating healthier. I can actually feel like I can go work out, or I can. So that level of motivation really is pretty responsive in a lot of our cases.
That's great. Wow. And so obviously, people who come to you are probably looking more for the benefit of something that's more psychiatric because you're a psychiatrist. But I've heard, what's that?
I'm not a psychiatrist, but
Oh, are you? Well, okay. You practice, sorry, you practice more of a psychiatric approach is what I meant to say, but you have a training in nutritional psychiatry and you practice a lot of that. But what about the non-psychiatric things, like people who may have fibromyalgia, chronic fatigue? For example, in my practice, I have patients that have mold toxicity, Lyme disease, chronic infections. Is there a place for people who have these things and don't have a primary depression as you said they're seeking for it?
yeah, I have had patients come in for treatment for ketamine, and then I say, oh, let's look at your gut health, and I do, some functional testing as well when indicated. Now, say, oh, well, let's get a gut biome study, and let's look at that, and then, oh my God, there's all this biosis here. Let's treat that while you're preparing, and I've treated patients for that, and they don't need ketamine anymore, or they come in with significant amount of pain, fibromyalgia. You look at their immune condition, and I've had patients who had a positive response to their symptoms of fibromyalgia with ketamine treatments as well. And I do sometimes look at inflammatory markers, and I see sometimes a reduction in their inflammatory markers just with ketamine alone after treatment. So that anti-inflammatory effect of ketamine is definitely there. When I have patients who have mold toxicity, as you mentioned, yeah, I mean, that's something, if it is indicated, I would screen for, because you want to be able to address, again, the root. And sometimes that root is not depression, it's mold toxicity. And so assessing that and treating that and directing that to the right provider is also just as important. A lot of our patients, the larger age group that we treat, are women between 40s and 60s. And what's happening in that time frame is that transition of change, the perimenopausal symptoms, the postmenopausal symptoms. So hormonal health is a very strong factor in mental health. And I think it is important to address that in their treatment.
Absolutely, absolutely. And so anyway, sorry for misspeaking. You're a pediatrician with training in integrative psychiatry, which is what I meant to say, but thanks for catching that. So as a pediatrician, you went to your MD, is that correct?
Yes.
Yes. Okay. And so how do you see, and I'm an MD, a medical doctor too, how do you see what you're doing received by other people who are MDs that are, just in the mainstream for the most part, and they don't have a lot of knowledge? Is this something that at least we're able to talk to our conventional colleagues about, or do you find it difficult to talk to our conventional MD-DO colleagues about?
Yeah, I would say there's two divides. There's the physicians that are curious about this and say, oh, wow, I've heard of this. And then there's the naysayers who say, no, what? You're doing what? And then convincing sometimes those providers is again more challenging until they see the results. So I would say there's definitely a clear, schools of thought on that, especially in conventional. And I still work as a hospitalist, and I see the system very much, still affected by the way things are happening in the healthcare field. And it really brings me to pause that if we don't change something now, we're only getting worse. The healthcare has become much more removed, much more removed from the bedside. When I was training residents and students, they were barely 5 minutes at the bedside and had to type up the notes and spend extensive amount of time putting orders in, and really removed from the bedside than when I was in residency, when we still had paper charts and we could still work, hard, but we weren't so, conditioned to just, be documenting and trying to, be at the computer screen, and the stress level has increased in healthcare, especially for providers, and some of the reasons why we're seeing burnout in the healthcare industry, and the effect of, providers also having been affected by the conditions of healthcare as it is, especially during COVID. I mean, during COVID, this is when things became much more apparent and has even persisted, I would say, to some degree. So yeah, convincing the system is going to take time, I think. And whether this is, we do have to have more awareness. There has to be. And that's one of the reasons why I do advocate for education and teaching. And I do a lot of work in the community with talks, presentations among my colleagues. And you do see, again, more awareness, more curiosity to something different, and I've had some physicians come through, for themselves for treatment, but not as much as you would expect, or I see a lot more nurses coming in for treatment because they've been at the bedside.
Yeah, yeah. I think nurses, for good or for bad, are a little bit more accepting of these holistic modalities. I find it really interesting, the psychology behind how physicians are some of the smartest people I know, but also some of the people that have least plasticity to adopt new things. So it's a really interesting thing. And I always love talking to colleagues that have the same background as I do. You were conventionally trained, and thanks to the diversity in the way that you grew up, you probably had a little bit more inclination to bring integrative medicine into your life. But unfortunately, not everybody has that, inclination. And so when they're conventionally trained and they're never exposed to more integrative things, they just don't. It's hard. It's hard to reach them. And I think that's sad, because being an integrative physician, as you and I both know, just means it doesn't mean that we suddenly forget everything we learned in medical school. We still apply it day to day. I mean, you couldn't have your ketamine clinic if you weren't, a person with a license to prescribe, right? You had to be a doctor, or, obviously nurse practitioners can also do this, but we are conventional doctors. We just have a wider toolkit. And I would love for our physicians who are in mainstream to reach out to us more and ask us more, and at least have that curiosity, instead of just kind of an automatic knee-jerk reaction saying, nope, it's not mainstream, so it has to be wrong. So that's one of my passion projects. And so I talk to doctors about that all the time. I talk to the public too. I tell them, keep going to all your primary care doctor, to your specialist, and just tell them that there's doctors out there that are willing to talk to you about integrative medicine, and just don't shut us off right away. So I'm trying to open that conversation, but it's always stunning to me how difficult it is sometimes, and not always. I've luckily been able to get a lot of people interested in integrative medicine. People probably never would have thought that they would be okay with integrative, holistic things, because they understand that what we do is evidence-based, and that we are still first and foremost medical doctors before being integrative, right? That's hard.
Yeah, I mean, you're right. The wider toolkit, I think. I think it's really simple, though, practicing medicine this way. It seems more natural. You can actually have a nice conversation with your patients. You don't feel the pressure of time. You get to know your patients. And I think that's the way it was. The art of healing is really sitting with and just listening and just learning about what the patient already knows and can already tell you what's wrong with them. But if we have, I think because of the pressures of the system, I think that's what's taking an effect on healthcare, not so much the doctor-patient relationship, which is being impacted, but it's really just connecting with your patient, seeing them as a human being, and as you would, for yourself, you would want the same.
Yeah, absolutely. And as much as a lot of patients out there are frustrated with the way the medical system is, and health insurance, and the fact that doctors don't have enough time for them, believe us, patients, we're just as frustrated as physicians. It's terrible to have to feel that rush that insurance will only pay you for a few minutes with your patient. And like you alluded to earlier with the medical charting, back when we only had paper charts, it kind of made a lot of things easier because we could, have eye-to-eye contact with our patients and not feel like we were having to have our eyes on the screen all the time. With the advent of these medical charts, it helped a ton of stuff. It helped make a lot of processes faster. The e-scripts are so much faster, and a lot of things are faster, but a lot of things are slower and more tedious for us physicians. So they're just like a lot of patients are not satisfied with the conventional medical system. A lot of doctors, even a lot of mainstream doctors, aren't. And the rates of burnout and physician depression are just skyrocketing. They're huge. And so I always welcome not only patients to look for integrative physician because they'll, keep your conventional doctors, you need them, but also seek out some integrative care. You're going to find more answers there. You're going to find doctors who are happier, but also to my colleagues, to any MDDO that might be listening who is a little bit curious about what integrative medicine is, maybe you should look into a little bit of training because it leads to a lot less burnout. We have more time with our patients. We can really help them heal a lot more instead of just symptom suppression. And again, I'm completely pro the whole medical system. I know we need surgeons. I know we need big pharma. I want those to continue to thrive. But for more of the chronic conditions, that is where we're just seeing better results with the way that we work in integrative medicine. So I really invite every physician out there to just be a little bit more curious and reach out to us. You can ask us about what we do.
Yeah. And I think just like you said, just being curious, questioning, why the system is as it is. There are things that one can do. I started this practice really because I was burned out myself. I could not do 15-minute appointments and do the whole care of that child. And with all of the complexities that I was seeing, it was impossible. Burnout is real. And, we really do get the opportunity to really do what we were trained to do in a lot of ways, to ask those questions in a way that we wouldn't be able to understand, how they were living. But we just don't get enough time to really get to that. And there is a lot of pressure on the outside of that. So really lifting that component. And then, of course, training, you're right. Training is important. And I continue to learn. As you can see, I've got just slew of, topics, right, ways of learning and the aspect of other things besides just a prescription, There are things out there that really do invite healing. And that could be spiritual practice. That could be an emotional release. That could be, a better sleep. It could be, just connecting, what's connecting with your loved ones or, being able to communicate. So that heals as well.
Amazing. Yeah, definitely. There's so many things that are not more medication. That's not another pill. That is really healing. And that's something that I love talking to my patients about and seeing them heal by these practices that are not what they thought they were coming to me for. They think they're coming to me for, more medication, more advice. But sometimes that simple advice of them spending more time with their loved ones is what really helps move the needle more than the prescriptions that I give them or the supplements that I recommend or the lab tests. Those basic things are what the human body needs to thrive. So
I network with each other, we need to rebuild this understanding of care broadly. I'm in Sacramento, you're in the Bay Area, who's out there, who's in the East, who's in the West, who's, I think right now patients are kind of like, well, where do I go? Who would actually, do what you're doing? And I'm like, well, I don't know. You have to kind of, navigate that. And that is a challenge as well. How people, even physicians have to navigate, the doctor that would be able to spend time with their patients for their different conditions. I mean, there's, integrative gastroenterologists, there's, integrative
absolutely, yeah,
neurologists, and there's, who do bring in that element as well. So we all need to be, connecting as well and communicating and advocating for change, I feel, as well in the healthcare.
absolutely.
What else too, right?
I know, right? Yeah. I mean, I think a lot of us, the reason that we're in this is because of the the burnout that we had. And so it helps us. The integrative training that we've gotten has helped us heal our patients, but first it helped us heal ourselves before it helped us heal patients.
Yes.
So absolutely, this is such a beautiful conversation. I'm so glad that we've met through this podcast. You and I did not know each other before now, but I feel like we're going to have a great friendship going forward. And so I really thank you for being here. I thank our listeners for listening to all of this. I hope those of our listeners who may be able to be helped by ketamine therapy, that they continue to do research on this, that they seek out qualified providers, and, hopefully people find providers that are willing to have them do the hard work, not just go in for one infusion if they need to do that, but be their, each person has to be their own advocate. But anyway, before we let you go, I know this was a ton of information, so if you could just give us 3 little pointers to our patients before we let you go, I would love that.
Okay. Well, the art of healing really is listening, and trauma is not what happened to you. It is what happened inside of you, and how that effect or has on your body manifests in itself very uniquely. So once we can uncover sometimes that root, we can really bring up and have that access to your true self.
Absolutely. Beautifully, beautifully said. And I'm so happy that you're healing so many people and that you'll continue to do so. So thank you so much for being here on the podcast.
Thank you.
Thanks for listening to Truly Healthy MD. I'm Dr. Monica Jauregui, and I'm so glad you joined me today. Remember, your health is in your hands, and every choice, no matter how small, can move you closer to feel your best. If you found today's episode helpful, please subscribe, share, and leave a review. It means so much to me. Until next time, take care of yourself and stay truly healthy.